Welcome to this Casement series on isolated seizures and Group 2 licensing by medical fitness to drive consultancy. We'll explore how legislation and clinical guidance apply to drivers with an isolated seizure, specifically when applying for a Group 2 license. We'll walk through the three-step approach: legislation, guidelines, and then apply it all to a real-life case study. The law provides strict rules for Group 2 licensing due to higher public safety risks. An applicant must be seizure-free for at least 5 years, off anti-seizure medications, and often undergo specialist assessment. Ultimately, the DVLA has discretion to grant the license based on medical evidence and risk assessment. The DVLA's medical guidance mirrors legislation, but adds clinical context. The critical point is the 2% per year risk threshold for further seizures. If the risk is below this, and the individual has remained seizure and medication-free for 5 years, then licensing is possible. This combines legal requirements with evidence-based neurology. Mr. X's case fits the criteria well. More than 5 years seizure-free, no ASM use, and no concerning features on investigations. However, guidance stresses that a recent neurologist assessment should confirm his seizure recurrence risk is less than 2% per year. If so, he has a strong chance of being granted a Group 2 license, though final decision rests with the DVLA. In summary, Group 2 licensing after an isolated seizure requires meeting the 5/5 rule, a favourable specialist report, and DVLA approval. If the applicant was still on anti-seizure medication, the application would almost certainly be refused. This structured approach, legislation, guidance, case study, helps clinicians advise patients consistently and accurately.